we have to work on our mindset. So we can acknowledge that, we're having these negative emotions and that we're struggling, but try to do so without judgment, right? Because you can't avoid the thoughts. They're going to be there, and it is absolutely normal to have them at times.
Hi, everybody. Welcome to our podcast, The Stamp of Approval. Thanks for joining. So during the pandemic, we're providing many podcast episodes with a variety of topics with some of the very best professionals in their fields so that we can help you during these uncertain times. We're going to get through this. Create a plan for yourself, your personal life, your business, and take action. I'm Kristin Stampini. My husband, Mark, and I own multiple businesses. In 2017, we opened our virtual assistant business where we help small business owners hire, train, and staff administrative assistants at a very affordable price. We have a real estate business as well. My real estate career actually began during the financial and real estate crisis back in 2007. And during that time, I was personally bankrupt and broke. Over the years, we were able to build a $1 million real estate team. Currently, we have a small real estate team as well as a real estate brokerage. We have a real estate investment company, and I'm also a real estate coach for the Craig Proctor Systems. So today, my guest is Dr. Rachel Needle. Rachel is a licensed psychologist and certified sex therapist in private practice, and is the founder and executive director of the Whole Health Psychological Center, a comprehensive psychological practice with therapists with a broad range of specialty areas. And Dr. Needle has presented her research and clinical work at national and international conferences. She has been quoted in a number of newspapers and popular magazines on issues related to mental health, substance use, and sexuality. So today, Dr. Needle will discuss how to stay connected and emotionally healthy and reducing anxiety during these uncertain times. Welcome, Rachel.
Thank you so much for having me, Kristin.
Oh, thank you so much for coming back. So last time I did this, I forgot to record.
Take two.
Yeah, take two. So welcome back. So let's start with, tell me what you're seeing today that's different in your normal practice. What are you seeing?
So we're seeing an increase of anxiety, fear, and depression. So this is a time of uncertainty. This is an unprecedented time in our country. We've never dealt with something like this before. And with this uncertainty, we get a lot of anxiety because we feel unsafe when things are uncertain. And we've known that. It arouses our stress response. So for many people during a time like this, it's not just the uncertainty, but it's also so much change. Right? So change itself will cause anxiety. So we're changed. We can't see our family and friends. We can't even leave the house, some of us, right? Loss of income, so much change that we are seeing increased anxiety for so many people. So it's scary.
Right. And how about, even when you're talking about so much change, think about either people are staying home with their kids, right, and having to homeschool,
yes,
which they aren't used to, or their kids are online, but they're having to help more, or maybe one spouse has a job, one doesn't, or both don't, and both working from home. So I'm sure those are some of the issues that you're dealing with today.
Oh, for sure. It's a lot. It's a lot on people, whether you're still working or you're not, having your children at home or having this change in lifestyle can be really tough for people. So I think that we're seeing a lot of people trying to figure out what their new normal is, trying to cope with their new normal. And even people that may not have had any issues previously are struggling too. So there's a lot of things that we can do. And I know you're going to ask me about that, so we can talk about that as well.
Go right ahead and jump into it.
Okay. So, for a lot of people, we have to work on our mindset. So we can acknowledge that, we're having these negative emotions and that we're struggling, but try to do so without judgment, right? Because you can't avoid the thoughts. They're going to be there, and it is absolutely normal to have them at times. Try to practice mindfulness, stay in the present moment. Don't judge yourself for having them, let yourself have the feelings and then choose to shift, right? So give yourself, for some people, I tell them if they're having a ton of anxiety and stress and these thoughts are occurring all day, I tell them to try to pick a time of day, even 2 times, and for 5 minutes straight, out loud, say everything they're worried about or stressed about, and, you know, give yourself that time so that if throughout the day you're thinking about this, you'll be like, okay, at 5 p.m. I get my stress time or my, you know, time to be worried. Also, a lot of people will, you know, do things differently now and not structure their day. So they may have lived a very structured life before with going to work, and they might have gotten up to work out, you know, had their routine, but they're not doing that now. I say it's really important to create structure. It may be a different type of structure, but make sure you still have your schedule, make sure you still have your routine, and stick to them. And for some of us, you know, making sure that we have kind of the goals of each of our days is really important. The other thing is, you know, we hear all around the media, people talking about social distancing. And I really want to encourage people to even just change the language, and that can help. This isn't social distancing, right? We're being social right now. I'm talking to you. I see you. We're being social. This is physical distancing, right? So I'm not in the room with you. I'm not looking at you. But make sure that you're maintaining connections with your friends, with your family. Do Zoom calls like, you know, we're doing Zoom now. You know, schedule something every day for like a tea or coffee time with somebody. You know, a fun big Zoom once a week with a group of your friends from, you know, a time in your life. So make sure that you're continuing to stay social, because for most of us, that is incredibly important for connection and for feeling good and connected in our life. So I also tell people, make sure you're taking care of yourself. For, you know, some of us, that means different things, but make sure you're eating healthy and exercising and doing different things that will help boost your immunity. Especially at a time like this when what we're fearful about is getting sick. And another thing that is always helpful for people is to help others. So when we give back to other people, so even if it's like, you know, buying groceries for a family member or somebody else, or, you know, donating to, you know, people that are out of work, or supporting a local restaurant, giving back feels good. So do that, because we want to do as many things as we can to feel good at this point, especially. Another thing that could be helpful is finding something that you can control. So a time like this, we feel so out of control. That uncertainty, and I mean, we cannot control what is going on right now. We just have to sort of sit back and watch. So find something that you can control, and by doing that, it will help decrease your anxiety. So for me, I started organizing my bathroom. So organize your files, organize your bathroom, do a project that you've been putting off, something like this. And the thing that I always make sure that I stress when I talk to people is know that there is help. So if you're struggling, there are mental health professionals like myself. We're doing telemental health counseling. So we do therapy over the internet. You can see us, we can see you. If you're not comfortable with that, phone is even an option. So make sure that you reach out. Again, my name is Dr. Rachel Needle, and I'm at the Whole Health Psychological Center, which is 561-721-6400, or wholehealthpsych.com. You can also always pick up the phone and call 211. So those are some good options if you're struggling as well.
No, that's great. That's a lot of information that you just gave. So
I got more. I stopped.
Yeah, because I want to kind of talk to you about what you just talked about. So making sure that you are still staying connected, right? Yeah. And making sure that, you know, even happy hours, people are having happy hours, right? Yeah. I even watch people that are cooking together. I've seen that, you know, where they're doing like, just kind of like you and I are doing, or setting up either their phones or the computers. They're actually cooking and talking to each other. So it's like you're with them, right? Or you're sitting there and having a glass of wine, either with a bunch of people, friends, family. But staying that connection. I mean, when people are depressed, it's tough to even get out of bed sometimes, right?
Absolutely. And there's different types of depression. If we're talking about major depressive disorder, you know, that is definitely something that some people struggle with. And it's not, you know, other people want to say it's about motivation. That's not what it is, right? There's so much more that goes into, you know, severe and persistent mental illness and things like major depressive disorder. So it's not as easy as, well, just get up. Yeah. So you want to make sure that you're monitoring that. And if you're struggling, make an appointment with someone like myself. We can also determine if you should make an appointment with a psychiatrist, and maybe medication would be helpful. But at least try to do one thing a day for yourself, and continue to try to stay connected. So even if you're in bed and you make a phone call, to a friend.
I always think that, we're going to get through this. It actually could be a lot worse, than it is. I mean, fortunately, it's not, it's not good, obviously, with people losing jobs and so on and so forth. But it could be, I try to look at it as very optimistic and say, hey, we're going to get through this. It's only been a month. Look at the different wars we've had and the years and years of depression we've gone through. The worst thing that could happen, obviously, is, somebody getting sick or you getting sick and things like that. But the thing is that we're going to all get through this. It's going to be different, okay? When we do open up, our different states or whatever, things are still going to be different, right? Things are going to start up slow because people are still not going to feel real comfortable going out, and we just need to be mindful, like you said. But start doing that now. Even going outside and sitting there, right? And getting, especially we're here in South Florida, getting some sunlight, right? Because that makes us happy.
Really important. Vitamin D. Yeah. And we're very lucky. I feel so fortunate, right? So we can go outside. And I think a lot of places in the country are beginning to be able to at least do that, just at least for a few minutes. But yeah, if you can get outside, if you can go for a walk where there aren't other people around, because now they're saying, still be careful with the air droplets outside. So make sure you're safe. If you need to wear a mask. If you have your own kind of backyard or balcony, get out in that, because it does really help with our mood when we have that fresh air. So absolutely continue to do things like that.
And we don't want to, if we are having, like Rachel was saying, if we're having, unfortunate thoughts or things like that, just give yourself a couple times a day, because the mind is so powerful, right? So give yourself a couple times a day, but don't try to dwell on that. Try to look towards positive things, right?
Yeah, it's important to allow ourselves to have emotions, right? So it's okay for us to be scared. I'm scared, right? It's a scary time, but make sure that you are, having those emotions and then working on shifting so that you allow yourself to have them, acknowledge them, don't judge yourself for having them, and sit in them for, don't sit in them for 3 hours. If you want to give yourself, 15 minutes to do it, then give yourself 15 minutes, but then shift.
Right. And
you have to choose to shift.
And I've been in my pity party, and of course I'm scared too. It's affected just about everyone's business, except for, of course, Amazon and, maybe Costco and some of the,
I saw.
yeah, Walmart, exactly. But it's affected most businesses. So we're all scared to a certain extent. But what I try to do is I try to have a daily routine, which you talked a little bit about. So can you expand on that, on a daily routine?
Yeah, it's really important to give yourself basically purpose, and to make sure that you're structured, because otherwise, we could stay in our pajamas all day if we don't, if we wanted to, even if we are working. You could go, just kind of move from room to room or not even get out of bed for hours. And that will tend to make us feel worse. I'm not saying you can't stay in bed one day and have a day, where you relax. Great. But most days you should be trying to schedule yourself so that you feel more regimented, so that you have purpose, so that you feel like you have goals in mind, and that you're doing things that will make you feel good about yourself and distract you. We want to stay, we want to stay in the moment at times. And then sometimes we want to be able to do things that allow us to not be thinking about what's going on in our world, because the fear is very real, because it's about loss of income. It's about change. It's about family members. It's about health, right? Not everybody will survive. That's a fact. We have people dying every day, and that is one of the scariest things to think about. But we have to take control of what we can. We can protect ourselves the best possible. We can continue to physically distance, wear masks, do what they're telling us to do, and that will help protect us so that we hopefully are not one of those people.
Yep. And then, reducing anxiety. What else can we do to reduce anxiety? Because people are obviously a lot more anxious today.
Yeah, so there's a couple of techniques we can talk about that people can work on at home. And one is one that I think people are very familiar with, called diaphragmatic breathing, where we breathe from our diaphragm. So really, when you inhale, your diaphragm should kind of expand. And when you exhale, it should go back in. So I tell people to breathe in through their nose, watching their diaphragm expand to a count of 5. Hold it for a count of 3, and then exhale for a count of 5. So practice doing that a couple times a day, even when you're not anxious, just to sort of get your body used to it. And over time, our physiological response will change if we continue to do that. So that can be really good for reducing stress. Other things include grounding techniques. One grounding technique is just about kind of sitting in your chair, wherever you're sitting, and starting at your feet and working your way up, noticing things, how your feet feel, how your feet feel on the floor. Then how the rest of your body feels, what you smell, what you taste, what you hear. One grounding technique is actually also, I think we talked about it last time, the 5, 4, 3, 2, 1 grounding technique, where you name 5 things around you. So maybe I see something, a spot on my wall, or a basketball sitting on my counter. I actually have one, so don't think that's crazy. I'm in my office and I have a signed Heat basketball.
Oh, do you really?
I do. Actually, it is from a live auction event from a charity event I went to, and actually it was purchased for me by a friend of mine. So she really wanted to buy something else, and I had already bought everything I was going to buy, and I said, "That's awesome," and she bought it for me. So I'm very lucky to have it. It's actually one of our congresswomen who bought it for me that I'm friendly with.
Do you have Dwayne Wade or LeBron or Bosch or any of them?
Unfortunately, no. Not any of them, but I'm very happy with the players.
Oh, that's cool. That's really awesome.
So name the 5 things around you. Describe 4 things that you can feel or touch around you. So like I mentioned, the ground under your feet, or even, my hair on my neck and my chest right now. Listen for 3 things you can hear. So I hear, the lawn being mowed behind me. I don't know if you hear it. I hope not. Sorry. Maybe your stomach rumbling if you're hungry. Name 2 things you can smell. So if you don't necessarily smell something in the place you are, go somewhere else and work on, seeing if you can smell something. And then say 1 thing that you can taste. So, maybe you taste something in your mouth from the last thing you ate, whatever it is. So that's a 5, 4, 3, 2, 1 method. And if you didn't catch all that because it was quick, you can Google it, and I'm sure something will come up, and it will be around that, same process that I talked about.
What does that do exactly?
It helps you to stay present in the present moment and reduce your anxiety.
Very cool. Yeah. So what else are you seeing with people?
So, we're just seeing for people that have experienced, who have a trauma history, we're still continuing to see this impact them in similar ways. And for others, this is a traumatic event. So we're seeing some of those trauma responses as well, especially in people, who have a family member or a friend or somebody who has, had coronavirus, and even some that, have lost people as a result of coronavirus. So,
wow.
Yeah.
So people that have lost people, or some of your clients.
Yeah.
Wow. And are you finding that the age is and the health is what's affecting a lot of them?
I'm thinking of the people that I know that have passed away as a result, and some were a little older, but many were my age. So recently, a nurse that I knew.
Is it because they're when you're talking about these, did any of them have health compromised or
No. Well, I don't know, but the older ones, it wasn't people that I knew directly. They were people that friends of mine are friendly with. So they were in their 60s, I think. But there have been plenty of people my age that I do know that have gotten it, and some that have died as a result.
Now, how about addiction? So
we're seeing an increase, and even in people sort of falling off the wagon or relapsing, however you want to refer to it, as a result. I mean, thinking about it as, there's a lot of things that lead to substance use, and one of them is, it helps distract us from these feelings that we do not want to have. So we're seeing a lot of that, as well as, people that don't have, those that didn't have that much of a safety net before, now losing what it is that they had, and it's leading to people just, beginning to use or continuing to use or relapsing.
So with addiction, and also you can't go to face-to-face meetings for people that wanted to go to meetings. right?
Right, and that connection is really important, that support, especially when you're, in recovery. There are a lot of online meetings and things going on that way, so you're doing a good job of keeping that, but for a lot of people, that's challenging.
So what do you recommend and if somebody's watching or, listening to this, what do you recommend that people like that do?
Continue to stay connected, do the online meetings, pick your support system. I mean, for all of us, right? Maintain, know who your support system is and reach out on a regular basis. Continue to do things like this and get together with friends and talk about it. And if you're struggling, reach out. Again, people like myself, I'm a psychologist and there's other mental health professionals. Almost all of us are doing online therapy. And like I said, a really important number to remember is 211.
Okay, and what's 211?
211 is a nonprofit organization that has a helpline, which you will get to a live person 24 hours a day.
Okay, wow, that's awesome.
And our local 211 is actually the call center that if you call the National Suicide Hotline in this area, you will get our 211.
Wow, that's awesome. So basically, a few things. I don't know if there's anything else that you wanted to cover today, but basically staying connected, staying on routine. Right?
Yep.
Allowing your breathing in the, what'd you say, the 5, 4, 3, 2, 1 method.
Yep.
And then making sure that to whatever your thoughts are, it's okay. Go ahead, but only do it a couple times a day because your thoughts are so powerful, right? And making sure that, you try to reduce your anxiety, in multiple different ways that you can, but staying on a routine and, getting outside, getting in the sun and things like that definitely help, right?
And for people that, have lost their jobs and are nervous or people worried about money, even if they haven't, creating a job and listing like what are your necessities can be really helpful. I talk to people a lot about positive affirmations. So make sure that you create some affirmations that work for you. So something like I am happy and I'm home with my family, or I will persevere. And, I've really been encouraging people to try to shift the way that they're thinking about things. And I know that's hard, but if you can shift this and try to find some silver lining and remind yourself that, we could potentially use this as a way to grow and persevere and for the future. So if you can shift your thinking and try to, look at this as a time to foster growth, resilience, a new appreciation for life, that can be really helpful.
Wow, that's awesome. And, we're in this together. I mean, we're all going through the different emotions. There are people out there. So I'm trying to educate as much as I can and bring on people like Dr. Rachel Needle. But also I brought on a CPA yesterday that actually went over like 10 different things to help you and yourself on what you could. And the thing is there's a lot of fake news out there. So you got to make sure that you are watching things with people that you trust. Okay. And I promise you everything that I bring on here is first of all, things are changing every day. Okay. Right. But when I bring it on here, that is what it is. The people that I bring on, and like the CPA that talked, yesterday, I'm telling you, he went over 10 different programs for you. So they were awesome. The different people that I'm bringing on, I brought on a lender. I'm going to bring on another attorney who is going to talk about the, forbearance and, what he sees in, real estate and such. And then I had an attorney on and she talked about, missing rent payments and, I'm bringing on earlier today, I had a different doctor on. So I am bringing on so many different professionals, therapists, doctors, CPAs, attorneys, whatever, to help all of us out there to educate and to make sure that we know our options and the things and how to handle it. Because none of us have ever been through anything like this before. And it's
Oh, for sure. And information is, something that will help us, right? So information educating us will help us to feel more safer and less anxious about what's going on, right? The more information, well, I don't want to say the more information, the better, because one of the things you said, reminded me that, limit your media and social media. Take it. So you can't sit there and just watch all day, and because it's just too much, right? We can't handle that much. And like you said, things are changing all the time. So make sure that you limit your exposure to media and social media during this time, and get information, but know your sources. Like you said, get the right information, update yourself, but don't become obsessed with the different changes and what you're doing. Do what you can to stay safe and to stay sane. I mean, I guess.
Yeah, exactly. And to stay sane, we're all trying to stay sane. Oh, my Lord. So Dr. Needle, so one of the things is she's such a giver at everything that she does. And, if you guys are really struggling and everything else, first of all, she's going to give you contact information to reach out to them. They, at this time, if you're really, really struggling, they're billing people on a scale or not, you can talk.
Yeah, we always work at my Whole Health Psychological Center, the practice, our goal is to never turn anyone away. So we always work on a sliding fee scale, but we are not turning people away. So if someone can't pay, it's not a problem. We're going to make sure that you get the help that you need.
Wow, which is amazing. Okay, that's awesome. So I'm bringing on too is, talking about having free consultations or helping or whatever. And that's what we're all about. And just like what you talked about earlier, the thing that I like to do probably the most out of anything I do is give back. Giving back is what my soul. So, and that's what you're talking about too. And that's why I do these podcasts as well.
Yeah. And you're a giver too. I mean, I think that's one of the things that connected me to you, when you're like attracted to somebody with, based on I think that's one of the things, like you do have such a big heart, and I love that you're doing this.
Well, thank you. And tell us your information again.
Sure. So Dr. Rachel Needle, 561-721-6400. You can also look at our website, wholehealthpsych.com, and reach us at 561-721-6400 again, or wholehealthpsych@gmail.com.
Awesome.
I also have a website, drrachel.com.
drrachel.com. Oh, yes. That's awesome. It has a lot of information on there as well.
There's some, and I'm starting to write some blogs there as well about different things associated with the coronavirus. So
don't wait, don't wait. Make sure you're reaching out. Make sure you're doing these things. And, I really appreciate you joining our podcast today, Rachel. And thank you.
Thank you for having me.
Absolutely. Thank you, everybody. Have a great day.